So I'd like to introduce Karen, who is a patient of ours. And Karen, you have quite a story, and I'd like to kind of work you through this story.
Okay.
And because I think it can really help a lot of other patients.
Okay.
And so, Karen, you had a knee replacement in November
Yes, total knee replacement.
of last year. And I saw you 7 months later in June.
Yes.
And the reason we saw you is that you had a real restriction in motion in your knee
Yes, a lot of pain.
and a lot of pain. And you have a condition that's called arthrofibrosis. You know that big term. And all that means is you have scar tissue in your knee. And things are not going so well for you.
No.
And when I first saw you back in June, your knee was actually really bent up quite a bit, wasn't it?
Right.
And trouble with flexion and pain with everything going on.
Yes.
And you've actually worked very hard. And we're having a meeting today, and we almost have your knee straight. So congratulations.
Thank you.
You've been working very hard with our therapists. And they are a really good group, aren't they?
Yes, they are.
And you've been working hard at home. And so it's been a combined program at our center, and as well you take that program at home.
Yes.
And so you've made some really substantial gains with your knee. And I think we were lucky because we saw you 6 months, 7 months after surgery.
Right.
But I'd like to go back to something that's really important. And I'm doing this not to be negative or to say negative things, but you were a single person.
Mm-hmm.
And you were told by the hospital that if you couldn't have someone with you, you'd have to go in a nursing home after total
Right.
knee replacement.
That's right. And I did not have anybody.
And so you went in a nursing home for 4 weeks.
Yes.
And then after that, you had 2 or 3 weeks where you had people come to your house to help you.
Right. I was on a walker by then.
But you had that restriction in motion coming out of that nursing home. That arthrofibrosis had already set in.
Right.
And they didn't think you were working real hard, but we've kind of reviewed this, and you were working hard.
I was working very hard.
But now you've seen the program that you really should have been under.
I should have been. I would not recommend a nursing home after surgery.
Thank
Not
you
now.
for that. Was voluntarily, but you've heard me say, do not go in a nursing home, and it's not saying anything really negative about nursing home. If you have a knee replacement, you need a knee specialist at
Yes,
rehabilitation.
I see that now.
And if you don't have that person that can give that little extra ounce or that little extra push, or to be able to diagnose scar tissue right away,
Right.
or to have you on the overpressure and how frequently you have to do that during the day.
Mm-hmm.
So if you have a rehab person that's seeing you like once a day or twice a day, that's really not going to produce any of the results, right?
Right.
So
I don't think they push me as hard at the nursing home that they do here at your facility.
Right.
They don't do that.
So I get to brag about our therapists. That's what this is about. But
Yes.
we wrote a program a number of years ago on overpressure.
Mm-hmm.
And 10% of the people that have a knee replacement get scar tissue. And that means many people go through knee replacement and just do great.
Mm-hmm.
But for that 1 in 10, if they're not on that program right away, they will have a problem, and you're still paying for that problem now. We're not through with this, are we? Because
No.
we've got better motion, and we've made some milestones, but we're actually going to have to go into your knee with an arthroscope and perhaps an open procedure to remove that scar tissue.
Mm-hmm.
And I know you're not too happy about.
No, I'm not, because I had a terrible experience with my first one,
Mm-hmm.
my first surgery. One thing I wanted to say is I was here last week to see therapy downstairs, and I noticed I had to get on this ERMI machine, and the guy next to me was a lot older than me. He'd just come out of surgery. He still had his bandage on and everything, and we're both doing flexion of the knee. His flexion is a whole lot better than mine, and I had mine a year ago.
That's
And he
right.
just got his done. I was very surprised.
And I'm glad you mentioned that, because the rule is that you get 0 to 90 degrees, 0 out flat to 90 degrees by the 3rd week.
Oh, wow.
And so you need a knee specialist to get you there.
Mhm.
And then by the 4th or 5th week, we really want your knee coming back all the way. And it may not be all the way, but it's pretty close.
Okay.
And so we have to make sure we get that motion early and that we keep the motion. Well, so I guess that you've heard me say very strongly, I will not allow my patients to go into a nursing home.
Yes.
Occasionally, we have to violate that rule, and there may be a week
Mhm.
after where a person needs that added help. But I wanted to make one final point. Modern knee surgery, with what we do now, you're walking right after you have the surgery,
Wow.
and you're walking the next day. And the goal is to use some of these modern advances so that you can take care of yourself,
Mhm.
and you can be putting weight on it. And many of my patients go home the day after surgery,
Wow.
or that second day. How long were you in the hospital?
I was in the hospital for 3 days,
For 3 days.
and then I went to the nursing home for a month.
Right.
I
Okay.
didn't have any pressure on my leg. I didn't have none of that. I
Okay.
wasn't walking or anything.
So I would probably tell you, again, without being really negative, that's the way total knee replacement was done, and is still done. I think probably about 5 to 8 years ago, there were some really dramatic changes in what we can do with patients with knee replacement, with less pain, being in the hospital less time, and really being able to get you back on your feet right away so you can take care of yourself. So,
I wish I had come to you first.
well, you're here now, and so we're working hard for you. And again, I congratulate you on your spirit, and you've really been working hard on this. And I really thank you for telling your story to us. I know it's going to help other people, and I told you that I want you to say it in your own words, and you can see why we don't recommend nursing homes or other facilities. You need to be in that facility right from the beginning. Good.
Thank
So
you
we
so much.
haven't given up on you. Haven't given up on that knee.
I know, and I like that.
Okay, we're still your champion to make sure this happens. Good.
Okay.
Thank you very much.
Thank you very much.
Thank you very much.